So welcome back, everyone. We're live on Facebook, so hi to everybody out there. Guess what? I'm wearing a cool hat right now. I have with me Peter Arona, and he is the owner of ABCDMedicare.com. Knock, knock.
Who's there?
I don't know the answer.
It's Medicare ANOC. It's the annual notice of change.
You know, we just listened to your ad, and
Right.
you know, I want you to talk about everything that's going on with this knock knock ANOC thing that you've got going. I love what you've done with this. So tell everybody what you mean by all of this.
Yeah, so what we're doing is bringing awareness to all the plan changes that are going to be happening in 2025. So as of right now, this month in September, everybody who's on a Medicare Advantage plan or a prescription drug plan will be receiving what they call an annual notice of change. And in the industry, and on the insurance side, we call it the ANOC, the ANOC, annual notice of change. And so we came up with this thing called the Knock Knock ANOC to kind of let people know that Medicare is going to come knocking on your door with this nice letter of telling you what plan changes are going to happen. There's going to be a lot of changes for 2025. You're going to be seeing an increase in maximum out-of-pockets if you're on a Medicare Advantage plan. That's the most you pay in any 1 year. You're going to see increases in co-pays for specialists, for hospital stays. You're going to see a lot of changes happening. You're going to see changes in the drug side, maybe your drug formulary, which is the drugs listed within your plan. Each plan can be different, so there may be changes with your drug formulary. Costs on those drugs are going to be different. It's actually going to benefit the consumer on a long-term effect. It's going to have a lower max this year. It's not going to have any donut hole coverage, so that means that you're going to go straight from your initial coverage to a catastrophic coverage, which means after you pay a certain dollar amount, it's zero for the rest of the year. All of these changes that are happening is going to come down to burdening the plan to cover these extra costs, right? And so what ends up happening is there's three things that are really affecting it. We can get into all the details of it. But the real message that we want to send people is that you don't need to know all the details, right? There's going to be reasons for CMS isn't paying the insurance companies as much, reimbursing the insurance companies as much money, so they don't have as much money to cover costs. The Inflation Reduction Act is going to change how drugs are managed and carried inside the plans, right? It's also going to there's going to be drugs that are going to come down in cost due to the negotiations, right? But it's almost a
lot of jargon.
Yeah, a lot of jargon going on there. And then the other one is going to be just that Part D for prescription drugs, whether you're on a standalone drug or on a Medicare Advantage that has a built-in prescription drug plan. There's going to be changes on how they can charge you for prescription drugs, right? In terms of there's going to be a higher deductible. There's going to be different costs associated. They can change the formulary. They can move drugs from a tier 1 to a tier 2, from a tier 3 to a tier 4 and make it specialty. They can remove the drug altogether. So this is, if you listen to the commercial, is the most important year for you to pay attention to your plan changes. And so that's the public service announcement that we're giving is that
Right.
You're going to get an ANOC. Don't ignore it. And hopefully the changes are minimal and you don't have to change or you don't have to look, or maybe you can live with the minimal changes that there are. But there's going to be people out there that are going to be impacted negatively. There's plans that are going away, right? There's going to be prescription drug plans that are no longer going to exist, meaning that you have to change your plan. They're going to force you to change it. There's going to be Medicare Advantage plans, such as PPO plans, maybe some HMO plans that are going to go away as well. So you're going to have to look for a new plan. If you don't make the change, then you will have no plan starting in January 1 of 2025, and you'll be on original Medicare, which is an 80/20 plan. So it's very important so that people look at the document. It's pretty easy to read. I've looked at like 4 or 5 of them here just this morning, and just pay attention. And if there's something that you need help with, you need someone like myself. I'm local, raised in Phoenix, Arizona, went to Maryville High School, graduated from Grand Canyon University, anchored in the Valley, right? We know the marketplace, we know the dynamics of the medical system, we know all the insurance companies and the partnerships that they have and how they work. And sometimes because you hear a commercial, just because it sounds great doesn't mean it's going to work out great for you. So this is where our extensive knowledge helps you, guide you into making a decision on what's in your interest as a Medicare beneficiary.
Also, you speak 3 languages. I love to bring this up because there's a lot of people that might need that service.
Yeah, I mean, English obviously, hablamos en español. So if you have family members that speak Spanish, in today's world, there's a lot of Spanglish. Right, the kids speak Spanish, maybe it's a little bit of English. The parents are fully Spanish, or they prefer the communication in Spanish. So fluent in Spanish, so definitely is an asset to help people, makes them feel a little more comfortable about what's going on, and the explanation in Spanish always helps. And the most important one is probably the language of Medicare.
Mm-hmm.
What does it all mean? Nowadays, it's even more complex. It's the waters are a little bit more muddier now because there's so much debris in the water, so to speak, that what is going to be the right plan for you, right? And even the insurance companies are they're fighting to figure out how many customers are we going to lose, right? Because there's going to be people shopping. Estimated in previous enrollment periods, it was about 10 to 15% of the market was going to change their plan or shop. It is now estimated at up to 50%, maybe even more. That's how many changes are happening. They're going to be forced to go look for a plan, or they're going to receive a negative, what they call it a negative ANOC, means it's not in your favor, and you're going to be looking for a plan to change. And so this is where someone like myself comes in, being an independent agent. We represent a majority of the insurance companies. We can't say all anymore, right? And so we represent a majority of the plans. I'm licensed and contracted with 13 companies across 14 states and have over 1,250 plus plans. Specifically in Arizona, though, you know, this is my resident state, and so, you know, we work with all the majors here in town.
Well, you know, we had also talked about how there's a lot of people out there who might be a caretaker for,
Mhm.
it might be your family member.
Right.
Right?
Yeah.
Or somebody that you are helping, taking care of someone.
Sometimes it's an influencer, right? So
That's that's right, that was the word,
yeah.
an influencer.
So sometimes it's a caretaker. Maybe you have a mother, a father, an aunt, an uncle that needs your help, and you have to overwatch them a little bit, maybe guide them. They're at that stage where they can't do it alone. Happens more often than you think. But there's also the influencers in the family. So the sons, the daughters, even like in my family, my aunt speaks to my dad, who speaks to my other aunt, who, you know, the uncle, and you know, they all talk to each other. And so like, hey, what are you doing? What's going on? What's the right plan for you? The number one thing you should do is don't think that your friend's plan or a plan that's on TV that looks great is going to be the right plan for you. When you call an insurance company directly, an insurance company would be any of the majors insurance carriers, United Healthcare, Humana, and any of those companies directly, they can only talk about their plans. So if they only have 4 plans or 2 plans, when there's another 100 plans in the marketplace, how do you know those are 2 or 4 plans are right for you?
Right.
This is where an independent agent like myself comes in. We contract with the majority of the companies. We do an analysis on what your needs are, and how does a plan fit for you? Where do you live? What area of town? We know that there's different medical systems in different areas of the valley, right? Banners in Sun City. There's a couple banners here. They're out in Mesa. Honor Health is located up in maybe Central Phoenix and Scottsdale areas, right? There's a Brazo, right? Where do you live by? Where do you get care from? Where's your doctor? Are you happy with your doctor, right? So we have relationships with doctor offices as well. So we bring a total assessment of what your needs, what's going on, do an evaluation, and to kind of tell you, here's are the top plans that we think that will work for you. And listen.
This year of all the years, this is what you're saying right now is please read that ANOC,
Right.
but also call somebody local here. Peter, you've been doing this for a very long time, and what I
Yep.
love about Peter is he's so passionate about what he does, and you're all about educating everyone. We've got to go to a break. When
Sure.
we come back, we're going to talk further, and we're going to talk about your events and the things that you got going on. Check him out on the website. We're going to do this one. There's 2 of them. It's ANOC.com, or you can also go to ABCDMedicare.com or call him. You can also text him as well at 602-770-9062. It's ANOC.com or ABCDMedicare.com.
Very good.
Okay, my friend.
Yeah.
So, yeah, I've been watching you on Facebook and stuff like that, some of the stuff that you got going. This is adorable.
Yes,
Yeah.
I created that.
Yeah, who did that?
I
You?
did, yeah.
Oh my God,
Yeah,
Peter,
did all
you're
that.
great. Yeah.
So I didn't do the character. I had someone do the character for me.
It's so
Took my
cute.
Photoshop and kind of said, give me a little
Yeah.
bobblehead dog knock.
Yeah, I saw that. I saw that on Facebook. That's exactly what it looks like. It's perfect. Yeah. So, and when do you actually start? When does it all start happening? In like a few days, or is it?
Yeah, so tomorrow tomorrow's October 1, right?
Mhm.
So we can technically start reviewing and looking at
People's-
plans for people
okay.
on October 1. Can't make a plan change. If somebody wanted to make a change, we can't make a change until October 15th.
Oh, okay.
And then we have until December 7th.
But October 15th
To December
through
7th.
December 7th is
Yeah.
the big time.
Right.
Okay. You been busy? Getting
Yeah.
ready, getting
Yeah.
prepared.
October's pretty much booked.
That's awesome.
Yeah.
That's awesome.
I mean,
Good for
I'm
you.
now squeezing in 7 o'clock in the morning, work later at
Wow,
night.
that's awesome though.
Yeah.
Yeah, but this is what you do. This is your time.
Yeah,
Right.
yeah, exactly. Helping people. A lot of it is new people. Some of it is current customers of mine who
Uh-huh.
hey, what's going on?
Yeah, yeah.
I just got my ANOC. I heard what you said.
Yeah.
Let's schedule an appointment. So those things are happening right now, and so we expect that to continue because people respond to notices at different times.
Oh
right?
my God, yeah, I know. They do it when they're ready
Yeah, exactly.
or when it's too late.
Yeah, well,
A
hopefully.
little over a minute.
Okay, thanks. Yeah, that's the one thing I know about people.
So one of the things we want to talk about is
Yeah.
the enrollment periods. So you don't have to. We'll just say enrollment period, and I'll jump into it.
Okay,
So people are aware, like what are their options, what can they do,
okay,
things like that, right? And then we can talk about the events and those
Okay.
two things.
okay. So fast.
Yeah. I can sit here and talk
Oh,
all
I
day.
know, I know.
Carol likes that. She likes the talkers. Come in and talk with Carol.
Yeah. It's funny because I do have a couple of people that do hours now, but I think it's not a good idea because it's a lot of money and
Yeah.
it's like you get so much more exposure when you split it up
Yeah,
just a little bit.
exactly.
And getting a little shot here, a little shot there,
Yeah.
right?
Yeah, exactly. Here we go.
Here we go. So welcome back, everyone. We're talking with Peter Arona, and he is the owner of ABCDMedicare.com. Knock, knock.
Who's there?
I don't know the answer.
You better read your Medicare ANOC.
That's right, folks. Listen up, everyone. You've been saying, as soon as you got on here, that you really got to read that ANOC. And, to me, one thing I love about being able to call, let's say, someone like you, is when I don't understand something, and I already know I don't.
Right, yeah.
I want to have somebody who can explain it to me in my terms, right?
Yeah, so, Medicare's complicated. If it's an agent talking to another agent, we speak like doctors, right? It just comes out because we're using terminology. The most important thing is to break it down so someone can understand it. Break it down into layman terms. What does that mean to me? How does that affect me? And so I think that's vitally important because a lot of stuff, what is the 80-20 rule? 80% of the time you're not listening, right? So that means you're only absorbing 20% of the information. And so you really need to make sure that people understand what's going on because they're making the decisions. And so that's kind of what we want to be the trusted advisor. And if that means that we don't get as many people, help as many people, then so be it. We want to make sure that it's quality over quantity. So.
And when you call him, please leave a message, and tell him what you're looking for because he will call you and talk to you and tell you exactly how he can help. Again, 602-770-9062. Check him out on the website. It is knocknockanoc.com or abcdmedicare.com. Enrollment periods and what their options are.
Yeah, so right now we're on the eve of the Medicare annual enrollment period. So officially we can start reviewing plans with customers. They're going to be available October 1, which is tomorrow. But you can't make changes until October 15th. So technically the annual enrollment period, the Medicare annual enrollment period is October 15th through December 7th. So, but we can start looking at plans and reviewing plans, say, hey, you're okay, you don't need a change, you stay where you're at, or you know what, we're going to recommend a change. Let's schedule an appointment so that we can change it either online through a Zoom call, or what I'm starting to do is meet people in person now, starting tomorrow. We're starting to meet people in person and say, hey, listen, this is what we're going to do. On October 15th, I'm going to send you the plan to sign up for and just move forward and get it done, right? So there's a 15-day window where we can help people be preemptive.
I would be proactive.
Yeah, exactly.
Right? And
Exactly.
give him a call. His phone number again is 602-770-9062. Tomorrow is the start of this, but you really can't do much until the 15th.
Correct. So the other enrollment period, so they have the what everyone knows is the annual enrollment period, October 15th to the 7th, December 7th. The other enrollment period is the Medicare Open Enrollment Period. They're now calling it the Medicare Advantage Open Enrollment Period, which is
They changed it again.
Yeah, January 1 through March 31st. So this is a one-time change. So maybe you missed the annual, maybe you didn't make a change and weren't aware that there was going to be changes in your plan. Well, starting January 1, you can make another change, right? Now, you're not supposed to be solicited to, but we know that no one pays attention to these rules, that everyone is getting bombarded with phone calls, and a lot of it is offshore phone calls, and they're trying to get you to change. I just had a customer this morning saying, I got a call at 6:30 this morning telling me that I need to change my plan. I just enrolled with you, why would I need to do that?
Oh,
I was like,
wow.
yeah, it's an illegal phone call, right? So be aware, use somebody that you know, like myself, locally in the valley. You can shake my hand, we can, share our coffee over a conversation. And so that's gonna be an important time as well. So if you do miss it, right, you missed the open, or maybe you're out of the country, maybe you weren't feeling well, maybe you were unaware or unsure what was the right thing, and then all of a sudden your plan changed January 1, you go like, oh wow, I didn't know I have a higher copay, I didn't know I have to pay for this now. You also get one more opportunity to change between January 1 to March 31st, one time only, right? The other enrollment period is what people call the CSNP, so it's chronic special needs plans. Those you can enroll every month, 12 months out of the year. There is no time period. So if you're diabetic, congestive heart failure plans, down in Tucson there's a COPD plan, right, asthma plan. So if you're down in Pima or up here in Maricopa, there's diabetic plans, or there's congestive heart failure, or
There's a million plans.
so there's people who are like, hey, I'm diabetic and I'm in the wrong plan. We can change you to a plan that's going to suit them better, and that can happen as effective as if I enrolled you today, it'd be effective tomorrow.
Well, I'll tell you
Right.
something, it sounds like it to me that you please give Peter a call and let him
Right.
help you, let him assist you and guide you to where, and that is what you're all about, is education.
That's right.
Check him out also on Facebook, you can see all of his fabulous videos that he has, and especially the new ones, the Knock Knock ANOC,
Yeah.
they're just so adorable, but you do have a reason for it, and he wants you to read those, and he will help you understand it. Again, that number is 602-770-9062. Let's talk about your events before
Sure.
we get going here.
So this Wednesday, we're going to be at MedTA Pharmacy. It's a nice little compounding pharmacy. It's a little boutique-y. They have a pharmacy and a clinic there, like a doctor's clinic, with a nurse practitioner and a real pharmacist, believe it or not, there. And so I'm going to be there this Wednesday from 10 to 12. Be there with a booth and a canopy, and you come by and we can talk and meet me there, and just have, if you don't, I call it meet the agent. So just stop by, meet me. You don't have to make a decision. You just want to know who I am, want to see if this guy's for real. Come on by, shake my hand. We can make an appointment, make a meeting. We can settle a date some other time we can meet. And then this Friday, we're going to be at the Phoenix Rising game. So they have a home game. I forget who they're playing, but we're partnering with United Healthcare, and it's going to be kind of a individual family plan. So not just Medicare, we do individual family plans, so the Affordable Care Act plans. So we're going to be out there representing United Healthcare. We'll have some educational information about Medicare there as well, based on United Care information. So we're going to be at a booth sponsored by United Healthcare, manning that booth, and so we're there doing stuff. And we're going to have a little giveaway if you want to stop by the booth. It's going to be, who's your favorite soccer player? Is it Messi or is it Ronaldo? And if you fill out the form and throw your hat in there, we're going to pick a winner and see
How
who.
fun is that?
Yeah, so you can come in and say, I like Messi, and wear your Messi shirt. If I like Ronaldo, wear your Ronaldo
That's
shirt.
really fun.
Obviously, Phoenix Rising wants you to wear their shirt, right? But that's we're going to be there and have some fun there as well.
Also, if you are looking to find somebody who can help speak in your tongue, which would be Spanish, if you need something like that, he is there. He speaks English, Spanish, and Medicare. But I love the fact that you have that, because there's a lot of people, when you don't understand it 100%, you kind of are apprehensive.
Right.
When you know that you could talk to somebody and you understand in their tongue, that makes it so much better.
Yeah, it's so much easier to understand it, to explain it, to absorb really the information, right? And at the end of the day, when you need help after the fact, after you've been enrolled, we're there for you, right? We're there to answer questions or maybe help you get a solution with the carrier, or maybe a benefit you knew you had, or how to get it active.
Not to scare anyone, but of all the years, this year's there are going to be a lot of changes. What is probably the number one, I don't even know if you can say it, but what, of people that really need to watch out for? Is it going to be your copay? Your medications?
Yeah, there's going to be, for example, there's a plan out there, the copay is going to go from $15 to $45 for specialists. So if you have a lot of specialists, that's $30 more for each specialist. I mean, just seeing 2 or 3 or 4 specialists a month can add up pretty quickly. So, the hospital stays. If you end up in a hospital, some of those plans are going to go up in cost for hospitals, right? Emergency is going to go up as well, right? So there's going to be different things in there, but there's different things that we look at, categorize. Okay, what's kind of like a snapshot of how the plan looks. We call it a summaries of benefits, and so we look at all those things. Okay, where are we at? How's it lining up? It's going to be really confusing, right? I was last week they call it a MEDICARE rollout with a carrier, and there's some of experienced agents that are there. Some of my colleagues were there, and they're like, "Hey, Peter, what plan are you liking this year?" I mean, their experience, and they're trying to get a feel for what are going to be the plans that are going to be I'm leaning on, right? So we sat there for about 10 minutes just kind of talking, which attracted more agents to have more conversation, because we're now looking at, okay, we're going to have to shift, not just current customers. We're going to have to advise people they should move. If you don't move, you're going to pay more, right? And even agents themselves are trying to figure it out, right? So this is all a lot of new information coming out. It's not like you plug something in and we know it like a computer, right? We have to study
You
these
have to
things.
really figure it out.
Right.
And here's the thing, too, this is really important. Everybody's different.
Mm-hmm.
So no matter what you do, even in your own family,
Correct.
right?
Mm-hmm.
I mean, and friends and all of that, don't ask anybody. Speak to somebody who's knowledgeable, who's here local, that's really important. And you know what, but the icing on the cake is he has to speak Spanish.
Yeah, and the other thing is this, a real common thing that I hear, I don't know why I hear it, because it shouldn't be happening, but doctors, primary care doctors will say, hey, you need to go find a new plan, I don't like this plan. Doctors are not licensed agents, right? They may not like the relationship they have with the carrier, or how they're being paid, or the frequency of being paid, but they shouldn't be telling their patients that, hey, I don't like this plan that you're on, you should really get a different plan.
Well,
Now,
why they say that? They know they're not on it anymore.
yeah. So even doctors, although they're part of the ecosystem of Medicare and all that stuff, right? I'm not a doctor. Don't come to me for advice about your heart or your leg or your head or whatever it is. Don't go to a doctor about advice on Medicare.
Right.
You can have your doctor work with an agent like myself and say, hey, here's my agent. I'd like to see if I can work with this person. But the reality is that it's so complex.
Of all the years.
Of all the years that you need to work with somebody like myself.
And somebody that can help you understand this. And that is something that, Peter, you are a seniors advocate. You truly are. And you help people understand it impeccably. There's people that turn 65 every day. We've talked about that before.
Right.
With those people. But right now, it's your time. And you better knock ANOC. You better go to that website.
Medicare's knocking on your door, so...
Go on to the website, it's knockanoc.com. Read your ANOC. He really wants you to, and if not, please call him. He's local here. Check him out also at ABCDMedicare.com, or call him at 602-770-9062. You can either call and leave a message or text him as well.